Welcome to Observations, an open conversation about women's health. This is a space where physicians, patients, and other experts can sit down and have honest, evidence-based dialogue that cuts through the media bias and brings clarity back to maternal care and how we can care for both patients, mother and preborn child. With each episode, we will have real stories, real science, but also real questions about women's health today. From clinical insights to lived experiences, to aligned perspectives, and yes, also respectful disagreements. This is our goal, to bridge the gap between physician and patient, to empower informed decision-making, and bring back and elevate compassionate, fact-driven care. Now, a quick note before we dive in. Not every guest on the podcast is going to represent the views or positions of AppLog, but we believe that having open and honest conversations are going to make us better. So, grab your coffee, settle in, and let's get into today's observation.
So let's dive deep a little bit more into autism. That's how we first got to know each other. My son Max is 22 now, was a patient of yours. And just as a little bit of backstory on Max, I had one of those pregnancies that I think I was pretty inflamed. I had this rash all over me that we didn't know what was the cause, and I took steroids for the entirety of my pregnancy when that started. But Max was meeting his milestones and doing just fine. And then Max got 8 vaccines in one day. And he got 2 in his legs and 2 in his arms for a total of 8 vaccines. And 2 weeks later, he went catatonic on me. He had this diarrhea that was just very kind of yellowy and mushy, and he just looked sickly. And that brought me on the pathway of trying to understand what happened. I've never once said those 8 vaccines caused his autism, but as you talk about epigenetic factors, I think we had a kiddo that had some risk factors, and they were the straw that broke the camel's back. And for me, what's been so important is, and I get this question all the time, is A, do vaccines cause autism? But B, I know you have a son with autism. Would you do the vaccine schedule any differently? And so when I want you to share with the audience, I've heard you talk about your own practice, how you were a practicing pediatrician in the community and started to become curious through observations. You had no intentions that this would be the pathway you would go on, but you were curious and astute. So could you share that with us?
Yeah, I was teaching in a residency program and teaching the regular CDC schedule. And I had a beautiful 15-month-old African American baby come in for a regular checkup. We did his developmental milestones. He was perfect. He didn't have any ongoing chronic medical problems. As was the practice at that time, I gave him an MMR vaccine. And within 2 weeks, I mean, the story is so similar to Max. He developed this chronic yellow diarrhea, and I had not ever made that connection before. I will tell your audience, this was before I ever heard anything about the MMR controversy. This was back in 1997. And in fact, Wakefield had published a paper before that, but I wasn't aware of it. And I couldn't come up with another explanation. And so, again, naively, I thought, well, somebody ought to look into that, at least consider it as a possibility. What I think now is that vaccines can either act as an antecedent, meaning sort of setting up a child to have a chronic stressor soon after or an acute stress that could tip them over, or they can be an actual trigger, or getting a lot of vaccines after you already have autism can perpetuate a pro-inflammatory state. So I will tell the audience that um, because OBGYNs probably are not aware of this. A couple of months ago on the CDC website, they put an asterisk beside their long-standing statements that vaccines don't cause autism and made a little asterisk notation that that was not actually an evidence-based conclusion. So there are, in my practice, about 49% of parents identify the vaccine, as you say, not saying that was the cause, but saying it either, in my mind, fits into the antecedent, trigger, or mediator category. About, I think it's 23% that thought MMR was the culprit, and then the other up to 24%, which makes a little less than 50%, thought it was multiple vaccines given at a time, especially if the child was already sick. So clinically, I think the kids that I have seen regress are usually the ones that were already sick. For example, they were on, let's say, Augmentin for an ear infection, which seems to tease out as a particularly high risk situation when they got 5 or 6 or 8 vaccines. Or they'd been chronically ill with some undiagnosed GI problem, and since some of the vaccines, certainly the live vaccines, need to be processed through the gut, the kids that have an inflamed gut are going to potentially be at risk for more reactions. Or you've got kids who have some kind of emerging, but perhaps not dramatic chronic neurodevelopmental problem that might be related to cerebral folate deficiency, which is associated with autism, or with some of the methylation biochemistry things that we've talked about, or with mitochondrial dysfunction that hasn't been recognized. Vaccines kind of tip them over. The analogy to me is that, you've got a certain bucket that you can fill up with certain number of stressors. And at some point, you overflow the bucket, or the straw that breaks the camel's back is the other analogy, or I've heard people say it's like it pushed him off the cliff. But there clearly is this regressive form of autism that, in my mind, has to be at least considered to be environmentally triggered. So I consider vaccines to be one part of the environment. There's also air pollution, which is associated with higher risks of autism. There's also heavy metal exposure. There's also maternal activation syndrome, which we've already talked about, which has been associated. So I really shy away from saying vaccines are the cause of autism. I also shy away from saying any one thing is the cause of autism. It's another concern I have with the current administration, because at least what they're saying is being reported as, we're going to find the cause to autism. And I think they're going to find that there are actually a lot of things. So it may be what they're saying, or it may be what's being reported. But if I had my wish, I'd counsel them to be more broad in considering multiple possibilities. That's kind of the way I think about it. And that's going to make some of your docs uncomfortable, because, we all were schooled that vaccines are wonderful, that they're safe and effective. But the reality is that for certain subsets of the population, they cause side effects just as all the other things we do. Medications, surgery, procedures cause potential side effects in subsets. So I hope that's a hopeful framework, or a helpful framework for helping your audience think about the role of vaccines in autism.
Why do you think we've never been able to have a trial to look at an alternate schedule?
Well, in terms of the official bodies like the AAP and the FDA and NIH, the general excuse has always been it's unethical to withhold a vaccine that would be helpful to someone in order to do the trial. And if you take people that are choosing not to vaccinate, there may be factors that would bias the results of the study. It's possible, for example, there's a much less vaccine uptake in people that homeschool their children, but they also breastfeed more, or perhaps they eat healthier foods, or, there's so many lifestyle factors that can be involved. So if you really were doing a great vax-unvax study, you would have all the factors the same, except the receipt or not of the vaccine. And that's going to be difficult to do. But the reality is that most vaccines are not ever tested against a placebo. They're usually tested against the prior version of that same vaccine, which can tend to mask side effects. Or they're tested against a vehicle for the vaccine. The most um, dramatic example of that is the Gardasil vaccine that was tested against a strong aluminum containing uh, brew and just didn't have the Gardasil part. And in my mind, that washed out a higher incidence of autoimmune disease in both recipients. It was around 2.6%. Um, so there are challenges in doing the research. And I just think that we're at a point now with the awful prevalence of autism that's 1 in 31. And I'm not talking about, people with autism that are just a little bit quirky and they're basically happy and they're neurodiverse and they just want us, to leave them alone. I'm not talking about those people. I'm talking about people like Max, who was actually looking sick, and people like the kids I take care of that have these demonstrable mitochondrial or immune or GI or detoxification problems. You know, there we need to consider autism as a medical problem, not just an issue of neurodiversity or being such a spectrum. So I hope that's helpful in the big scheme of things. I did have a colleague, and I was going to participate in this. We were going to do a 18-year prospective study about, the differences between kids who are vaccinated and those who withhold vaccines or are vastly under-vaccinated. But I don't think we can afford to wait 18 years for that because the rates are continuing to rise exponentially. So I would really like for the administration to dive into a lot of the records that we already have and do some retrospective studies of vaccinated versus unvaccinated children. I'll tell you that there are at least 11 studies that I'm aware of that show that the unvaccinated have significantly less chronic illness. I happen to be associated with one of the studies, which looked at my practice, and we found less GI disease, less ear infections, less developmental problems in the kids that were unvaccinated or undervaccinated compared to kids that had received any vaccines. Actually, we counted our patients as vaccinated, even if they had one vaccine. So I misspoke a minute ago. I should have said unvaccinated versus any vaccines. And then other colleagues have found, less ADHD, less autism, less eczema, less other types of autoimmune illness, less behavioral problems, less psychiatric problems. And Susan, your audience may not know about this, but Henry Ford, which is a university hospital in Detroit, associated, with a lot of academic professionals. They actually rose to the challenge and decided they would look retrospectively at their vaccinated versus unvaccinated kids. They had a huge number of kids, numbering, I want to say 16,000, but it's been a while since I looked at it, so that may not be right. But they found the same thing I found, that there was more chronic illnesses, was significantly more. And they had those results in 2020 and they didn't publish them. And that's one of the things that's so frustrating to me is that with our current paradigm of publishing, it's very difficult to publish a vaccine study that calls either safety or efficacy into question. So much of the literature is about, well, this, the Prevnar that covers 20 strains is better than the Prevnar that covers 13 strains. Or, we saw less hospitalizations with, this or that vaccine. But it's very hard to say, are we alleviating acute illness but causing chronic illness, which arguably, could be even more difficult to manage. So I would encourage your audience to look up the Henry Ford study, and there was a documentary made about it called An Inconvenient Study that won an award at the Malibu Film Festival just this past fall. So if you look up An Inconvenient Study, I think that if you can watch it all the way through, it will make many physicians who have trusted what they've learned about vaccines, what they've been taught about vaccines, to perhaps rethink it. The movie opens with the story of a set of triplets who had their well child visit all on the same day, and all three of these triplets regressed into autism, one within about 2 hours, one within about 4 hours, and the other one within about 8 hours. And it's very hard to explain that that was just a coincidence or a natural occurrence when you've got the triplets. So that, the statistics for having a chance thing happen like that 3 different times on that particular day when nothing else had changed does argue very strongly that there are some kids that regress into autism after vaccines, whether they were acting as a trigger or they just, had some kind of horrible either mitochondrial collapse or inflammatory surplus after those vaccines. I don't really know, but it should at least open up that question and not make it words we can't utter without being called, uh, crazy or a quack.
Yeah. Yeah.
It's worth looking into.
Yeah, I think one of the reasons with our new podcast observations that we wanted to have conversations like this is because just because you question the science doesn't make you a quack. It actually makes you intelligent. It makes you curious, a truth seeker. I mean, I wonder, why do you think so many healthcare professionals, doctors included, why do you think our professional medical organizations, it's so hard for them to accept, or so hard for us, because I'm sure at times I'm like that with some research. Why is it so hard to accept and think about new research contrary to perhaps practices we've done for so long?
Well, I have to attribute the credit to this thought to my husband, who's a psychiatrist. When I first started asking that question, he pointed out that, especially for pediatricians, so much of the good that we thought we were doing was that we thought we were saving kids from meningitis and polio and diphtheria and pertussis from giving vaccines. And we do it every day over and over and over again. And we did that because we wanted to help. We thought it was the right thing to do. When we see research that suggests that, yes, we may have decreased the prevalence of acute illness to whatever degree you would argue about, but we gave a bunch of kids autism, which is for many a lifelong disability. Somewhere in the 20 to 25% of kids with autism are pretty severely affected and may not ever live independently. That's a very difficult burden to take on. And when I first came to the conclusion that I had hurt this kid in particular that I mentioned, and probably others that I didn't recognize, it is hard to accept that. And by its very definition, science is always ever evolving. But if we've been schooled in science and we've made a lot of clinical decisions on that science, and then something raises the issue that maybe we were making wrong decisions, that's hard for us to live with, because most doctors are motivated because they wanted to help people and heal people. So that's my psychological explanation. And I'll leave other people to speculate about what their thoughts are.
No, that really resonates with me. Tell your husband thank you for providing that. Because you're right. The purpose of medicine is health and healing. And, we should always be moving towards that direction as OBGYNs, as for me, as a doctor that practices life affirming medicine. I don't ever use death as a therapeutic modality, but I have colleagues who have for years until one day they realize that baby's a patient to that embryo, that fetus, and then they they have to heal from. They thought they were helping women, and so there's definitely that parallel there. So let me wrap this up with one question. You have that patient who, looking back, your decision to follow the guidelines that led to giving the vaccines the way you did led to some harm in your eye, um, and led probably to a whole different way you practiced moving forward and things you emphasized. From a real practical standpoint, let's finish this out with, what do you do differently, because you've learned that in your practice, to try to help those siblings or future patients, to prevent that harm?
Yeah, so I actually wrote a paper about this that I will forward to you guys and you can put it in the show notes. And my question was, could I use what I learned from all these patients with autism and what seemed like had, sort of been difficult for them to handle and incorporate it to prevent autism in my practice. And I actually had a very low rate of autism in my general practice. At a time when the rate was 1 in 50, my rate was 1 in 297. So I theoretically should have had 6 times as many kids in my practice with autism. So, we emphasize the whole gut flora thing with probiotics for infants born by C-section, trying to inoculate the C-section babies with their mother's vaginal flora and trying to avoid antibiotics. So, working on the gut flora. I hired a nutritionist to talk about the value of whole foods and the importance of avoiding ultra processed foods. We paid a lot of attention to vitamin D status, both for our babies, we would recommend starting vitamin D supplementation at 2 weeks of age, as long as breastfeeding was already established. If it wasn't, we would sometimes push it off to a month. We had a very high rate of breastfeeding and long breastfeeding. So, at a time when it was about a 42% breastfeeding rate in my community, we at least had people in the low 90s that initiated breastfeeding. And we had a lot of patients that were still breastfeeding at 18 months to 2 years. All those things I regard as prevention strategy. We didn't use acetaminophen in our babies when we gave vaccines, and we tried not to use it when they were ill otherwise, unless the fevers were significantly high, such that they were causing rapid heart rates or difficulty breathing. And then I modified my vaccine schedule. I looked at the amount of aluminum in childhood vaccines, and there's some work that I can also forward to you that shows that if we actually follow that CDC schedule and apply EPA guidelines for aluminum levels, we are actually keeping infants in chronic aluminum toxicity for the entire first year of their life and giving them little bursts of acute toxicity when we give them multiple vaccines at 2, 4, and 6 months of age. So I always look for the lowest dose of aluminum in vaccine brands because they are different. And then we never gave more than two at a time. And sometimes we would give just one at a time. Or sometimes parents would choose to wait until 6 months to start their vaccines. That's a little tricky because illnesses like pertussis are more severe in the first 6 months of life, but antibody responses from the baby aren't that good in the first 6 months of life. So it's a little bit of a trade off there anyway. And we did honor informed consent and had some people who, for religious reasons, chose not to get vaccines because they didn't like the fact that they either contained aborted fetal tissue or were tested in aborted fetal tissues. So we had to respect their religious convictions. And I practiced in a city that was in the foothills of one of the largest Christian conservative universities in the country. So I always did MMR vaccine at the age of 2 instead of 3 instead of 1 when I did give it because of a study that the CDC did but did not publish, suggesting that younger age receipt of MMR carried a higher risk of autism, and that was especially true for African American children. So in African Americans, when they get the vaccine prior to the age of 3 years, their risk is much higher of developing autism. So for those kids, we gave it at age 3. I also never gave Gardasil in my practice. You guys know a lot more about cervical cancer than I do, but I was very concerned about the reports of increased autoimmunity and neurodevelopmental disabilities in the girls that were healthy prior to getting Gardasil. And I looked at some of the data from a couple of countries around the world suggesting that it wasn't really having that good an impact on the cervical cancer rates and that the age of getting cervical cancer was actually decreasing in the vaccine recipients. So I didn't do that. And we also tried to get our kids to get chickenpox the disease instead of chickenpox the vaccine, because if you get the disease itself, healthy children usually handle it fine and they have lifelong immunity. Whereas if the children are healthy and get a varicella vaccine at a year of age, their immunity wanes so that they're not very well protected when they're young adults. And when you get chickenpox as a young adult, you're more likely to get the meningitis with it or the pneumonia with it than if you get it as a toddler. So that was a rationale for why I modified my vaccine schedule. And, you know, it was purely my sort of decision-making process after learning all that I've learned. It's kind of interesting that the more recent ACIP committee has come out recommending a schedule that looks very much like what I did in my practice starting in about 2004, 2005. So I actually think that they made some good judgments, even though they're getting a lot of criticism for it, because I think the decisions we make for healthy children who have plumbing and good public health measures and safe water can be different from the decisions I would make for a child living in Africa with dirty water and no access to indoor plumbing. We have to start considering the environment of our patients, I think, rather than just making blanket vaccine decisions for the whole world. So that's my soapbox.
No,
And
it's so much more than a soapbox, because what I love about it is it's research based. It's also your clinical evidence. I mean, when you look at what is evidence based medicine, you know, it is taking the best available research, it's taking our clinical expertise, and it's taking the patient's perspective, values into consideration. So you're practicing evidence based medicine. I know I could listen to you for hours and hours and hours, and I think our audience is going to find so much of what you said very valuable. And I just thank you for your work you've done all these years, continue to do. Congratulations on your book, and perhaps we can get you back and talk specifically about your book, because you are a wealth of information, and I understand it's your birthday. So happy birthday, and thank you for spending part
thank you.
of it with us. So everybody,
Thank you.
you're welcome. Thank you, Liz. Thank you to our audience for joining us today, and we look forward to having you on future episodes of Observations.
We hope that you enjoyed today's episode of Observations and that it broadened your perspective on women's health and how we can care for both patients, mother and preborn child. If you like this episode, make sure to give us a 5-star review where you can find your podcasts. Make sure that you like this on YouTube and subscribe to our channel for more episodes coming up. And if you have any suggestions on any topics that we should cover or guests that we should have on, make sure that you email us at media@applog.org. Again, thank you for joining us for today's observation, and we'll see you in our next episode.